I hope everybody's managed to make it back after the break and managed to get yourselves a drink. I'm delighted now to be able to hand over to colleagues from the CQC. We have with us Yin Nain and Stefan Kali, who are going to explain really a little bit more about their involvement in terms of Oliver's training. So over to you guys. Thank you.
Thanks, Philippa. Good morning, everyone. Really good to be here with you and have so many people on the call. So I'm Stefan. I'm one of the senior specialists here at CQC for people with a learning disability and autistic people, and joined by my lovely colleague Yin. Hi, Yin.
Hi, Stefan. Thanks.
So obviously, we want to talk a bit about our regulatory context of this, but just to sort of introduce, I mean, Philippa said so eloquently at the start that this isn't just a nice to do. We really want to sort of stress the importance of this, and Oliver McGowan's story and death really highlighted the importance of having staff who are skilled and confident to meet the needs of autistic people and people with a learning disability, and the health inequalities and early mortality experienced by autistic people and people with a learning disability can be reduced when staff have got the right skills and knowledge to care for them. And autistic people and people with a learning disability, of course, access all of the services we regulate. And that's why this legal requirement applies to all CQC registered services. Next slide, please, Amy. So as we talked about in the webinar, SIFI is statutory, and this is where it actually comes from. What does the legislation actually say? And that's the Health and Care Act 2022. And Section 181 on the mandatory training on learning disability and autism says that regulations under Section 18 Health and Care Social Care Act 2008, so that's the 2014 regulations, must require service providers to ensure that each person working for the purpose of the regulated activities carried out by them receives training on learning disability and autism which is appropriate to the person's role. Thanks, Amy. Over to you.
Next slide. Thanks, Amy. Yep, as Stefan said, the CQC's approach and position on the training requirement on learning disability and autism is that CQC regulates compliance with the training requirement on learning disability and autism. It includes, but isn't solely, the Oliver McGowan Mandatory Training, and that regulatory activity is done in a proportionate way. And CQC will continue to regulate health and social care providers and services which are registered with CQC on the training requirement under the requirements of the regulations, particularly under Regulation 18 on staffing. Sorry, Stefan, I think we swapped slides, but do you want me to carry on to the next one, Amy? Thank you.
We can go with the flow.
Thank you. Just as a reminder for CQC registered providers, it is the duty of registered providers for CQC to consider what's appropriate training and to train staff as necessary to enable them to carry out duties that they are employed to perform. There's information on CQC's website in terms of training on the training requirement on learning disability and autism, and these will be updated, especially as the Oliver McGowan Code of Practice is laid in Parliament and published. So please keep checking on our website for those updates. And just to reiterate and to confirm, CQC isn't able to provide advice or any additional information to registered providers or any interested parties in terms of the content of the Oliver McGowan Mandatory Training. That's in the Code of Practice, and CQC will regulate on the training requirement itself on learning disability and autism. Thank you. Thanks, Amy. Next slide, and over to you, Stefan.
Thanks. So just continuing with our approach and position and expectations around the Code of Practice. So any training that will be provided will be expected to meet the standards set out in the Code of Practice to be developed. And as colleagues have mentioned on the call today, the government will be recommending in the Code of Practice that registered providers procure the Oliver McGowan Mandatory Training for their staff. And to that extent, the government will publish the Oliver McGowan Code of Practice for learning disability and autism. And just to make clear that that is not a CQC document, but one that we will take into account when making certain regulatory decisions. Thanks, Amy.
So in terms of capabilities for the training requirement, we CQC would always recommend registered providers to familiarise yourselves with the core capabilities framework for supporting people with a learning disability, and also the core capabilities framework for supporting autistic people. These include, as the title suggests, the key capabilities and skills needed for staff who will be providing care and treatment to people, autistic people and people with a learning disability. And we expect that alongside the core capabilities, the Oliver McGowan Code of Practice will outline those required standards, including co-delivery of the training with people with lived experience, and also other criteria such as duration and accreditation for the training requirement. Thank you, Amy. Over to you, Stefan.
So on our expectations, so we expect that registered providers will ensure their staff, regardless of their level, seniority overall, receive training to enable them to provide the appropriate care to autistic people and people with a learning disability. And registered providers must also ensure that staff providing care have the qualifications, competence, skills and experience under Regulation 12, that's safe care and treatment. And that registered providers should be assessing staff to determine whether their staff have the necessary training and competence. If not, registered providers will need to source the necessary training in order to meet the requirement of Regulation 18 staffing. Thanks, Amy. And on our expectations to continue, then that requirement means that, of course, more staff need to complete that training that's appropriate to their role. And in this context, some staff might have already received training, and then it's up to registered providers to make sure that that training that has been received is suitable, is effective, and in line with the code, of course. And whatever decisions are made around that training, for that, registered providers must be able to demonstrate how that decision was reached if asked. If training that has taken place so far doesn't meet the standards as outlined in the Oliver McGowan Code of Practice, once it's published, then providers must or might have to ensure that their staff receive further training as appropriate, and that must be equivalent to or better than the Oliver McGowan Code of Practice. Thanks, Amy. Over to you, Ian.
Thank you. So in terms of the Code of Practice, there are 4 standards that cover tiers 1 and tier 2 of the Oliver McGowan training. For standard 1, it's that all staff receive training that's appropriate and covers the minimum curriculum in the capabilities for those core capabilities frameworks which support people with a learning disability and autistic people that we mentioned earlier. Thanks, Amy.
And I know that Emma already talked through the standards in detail, so just touch upon standards 2, 3, and 4 here. So 2 being around the learning, enabling staff to put their learning into practice. 3 being about the minimum amount of live and interactive training that's co-produced and co-delivered by people with a learning disability and autistic people. And then 4 being that training is based on evidence, being quality assured through trialing, ongoing evaluation, and accreditation. Thanks, Amy.
Thank you. And in terms of CQC's regulatory responsibility and remit, CQC, our operations colleagues, will continue to take a risk-based approach to when looking at registered providers and services in terms of the training that staff are receiving, and to make sure that the services are compliant with Regulation 18 for staffing. We'll continue to be open, transparent, and to take action which is proportionate. And also, where staff have been trained, CQC will look to see how registered providers can make sure that staff are competent and are putting into action what has been learned from the training requirement on learning disability and autism. We'll also make sure that staff look at for those staff who haven't yet received training appropriate to their role. We will check what the registered providers and services what actions are being taken to mitigate any potential risks from for those people using services as a result of the training not having been fully completed yet. CQC will take account of whether people with a learning disability and autistic people have, in whatever health and social care setting where they're receiving their care and treatment, whether they're receiving care which is meeting their needs and also allowing them to have appropriate choice, dignity and independence as they would wish. And then also where we do identify breaches of regulations, CQC will take regulatory action, which may include enforcement action as needed. Thanks, Amy.
Thanks, colleagues, for listening. And there are just some links on these slides for you to access for further information. And handing you back. Thank you.
Thank you.
Thank you. Thank you both. And gosh, that was a lot of information, wasn't it? But it's exactly what we've shared before. So thank you for you know, kind of like explaining how the process works, because we had a lot of questions around CQC and how we all kind of like work together and what you will be checking. So that's really helpful. So I'm delighted that I think we've now got a video from one of our experts with lived experience, Alan Morrison. He's an autistic expert, and he is going to take us through a little video that's been made about how employers can take next steps and move forward with Oliver's training. So I think I'm going to play the video now. Thank you.
Hello, my name's Alan Morrison and I'm an expert with lived experience. I've been working on the Oliver McGowan Mandatory Training on Learning Disability and Autism for 4 years. So my message to employers is now is the time to take action. There's so much investment and so much work gone in behind the scenes to help build this programme and the structures needed. There's so much interest from people with lived experience out there who are keen to get involved that there's never going to be a better time to act than now. As an autistic person, I've had some poor experiences in healthcare. I'm always afraid that people won't understand my needs or won't listen to my issues or won't understand what they are. If employers can shout about their commitment to Oliver's training and share their progress, it would reassure patients and staff and people like me that you're committed to changing and improving. It'll help motivate your workforce to complete Oliver's training and help deliver better outcomes for autistic people. There are some fantastic resources available to help with this in the communications pack on the NHS England website. We hear there is some understandable uncertainty about how to recruit experts with lived experience. For some employers, this is unfamiliar and a little daunting. I was involved in co-producing and co-developing a webinar for employers. This webinar is available on NHS England's website and covers topics like how to work in co-production, recruiting autistic people and people with a learning disability, and supporting co-trainers in their role. It was fantastic to be involved in the production of the webinar. I was asked what I thought the important messages and ideas were, and the team I work with put those into the webinar and did all the technical work, and it was a very rewarding experience to watch the webinar take place and to see so many messages in the chat and to see so many people engaging with the topics of the webinar. I'm really pleased to hear about all the progress with rolling out of Oliver's training. There's lots of learning and best practice to guide employers. There's so much information on the NHS England web pages. I urge all employers and integrated care boards to make full use of the guidance available to you. Use the resources to your advantage. NHS England have provided frequently asked questions, a web page full of employer resources, information on how to get involved with your integrated care board, and lots of other background to the training.
Great. So I'm going to thank Alan for producing that for us. I don't think I need to add anything to it there, to what he said, because you'll get the information afterwards. But please do use those links. And the session that he referred to in January was really good and has had some really great feedback, and people have accessed that since the webinar. So do have a look at that. But I'm now going to hand over to Paula. It's my real pleasure to hand over to Paula, who's going to give us an update on Oliver's campaign. So Paula, over to you.
Well, thank you, Philippa. I want to start by saying good morning to every single one of you. You know, I feel really privileged to be able to speak with you today, and I'm really grateful that you've given up your valuable time. But what I want to do is I want to really talk to you openly, honestly, and directly from my heart. First, I would like to thank all of you for the work that you do every single day, making a difference, saving lives, especially during these, these challenging times. I would like to thank the millions of health and care staff who come into work each day wanting to make a real difference to the people they are caring and supporting. Now, we know that they work tirelessly and compassionately. And yet, despite so much good intention and compassion, people with a learning disability and autistic people are still dying the most horrific and avoidable deaths simply because their health and care needs are not met. You know, as many of you will know, my teenage son, Oliver, who's behind me, Oliver was autistic and he had a mild learner disability. Now, Oliver died a highly avoidable death in an NHS hospital because of a severe allergic reaction to an antipsychotic medication. Medication that was administered against Oliver's advanced verbal decision and against our wishes as his mum and dad, Now, this was medication that Oliver simply did not need. Oliver did not have a diagnosis of mental illness. We had brought Oliver to hospital having simple focal seizures and absolutely nothing more. His death happened because his and our voices were not listened to or heard. Now, for those of you who are not familiar with Oliver's story, I do urge you to complete the first part of Oliver's training, which is the e-learning, to really hear Oliver's story in full. Now, we know from NHS England's Learning from Lives and Deaths review, which Maria mentioned earlier. Now, this is known as LEADER, and I really hope that you are all familiar with this. They are reporting year on and year out that women with a learning disability die 25 years younger than those in the general population. Men do not do any better. They are dying 21 years younger. Let us just pause for a second and have a little think about that. We know that a person does not die prematurely simply because one learns differently or at a different pace. These communities are dying avoidable deaths simply because their health and care needs are not met. And Oliver, that boy behind me, he's amongst those statistics. He is just a number. Now, we know that these numbers don't factor in the unreported deaths, the misdiagnosis, the trauma, the near misses, the diagnostic overshadowing, the over-medication, the unnecessary restraint and the exclusion. And this is still happening every single day in our health and care settings. And we all need to ask ourselves, well, why is it? Why is it that we're still not getting it right for autistic people and people with a learning disability and their families? And my personal conclusion is that, our wonderful health and care staff are getting it wrong simply because they do not always understand people with a learning disability. They don't understand autistic people or how to support them best. And I suspect that many do not realise that they don't understand or possess those skills until it is far, far too late. They do not always know or understand or recognise things like, sensory crisis or overload. They don't always know how to communicate effectively with autistic people and people with a learning disability, or even how to make the most basic of reasonable adjustments. They really do need to, to help start to address their own unconscious bias, which is something we all have, but we are all simply unaware that we do have it. but it's essential that we step back and self-reflect and check that bias. You know, because we know that this too often leads to such tragic and avoidable outcomes. You know, people with a learning disability and autistic people tell me daily that, you know, they are terrified to come into our health and care settings because they feel it is a really dangerous place for them. And quite often they're not wrong, are they? They tell me that they are scared that staff will make things much worse for them. And for some, they feel that they will be incarcerated into mental health hospitals and sent many miles away from their own homes and their families. And let's be honest, their fears are very real because we know that this does happen far too often. You know, however, with the right training, it is possible to help our staff to understand that what they do to help most people may in actual fact be harmful and traumatic for a neurodivergent person. That they can learn to make the correct adjustments needed to safely support a person with a learning disability and or an autistic person if they simply just stop and pause to ask, listen and do. It's really not that hard. It really is now time for real change. Oliver's training is not and never has been about pointing fingers. It's not about blame, but it is about all of us coming together, learning and working together collaboratively. That is really important. We really must try to prevent further avoidable deaths like Oliver's from happening over and over. We must all be strong enough to say, look, we must do better, and not because we're told to, but because we really want to. And this must come from your own hearts. We must all have it within us to really want to change what's gone before, changing culture, hearts and minds. Now, we have come to this pivotal moment. We now have all the ingredients for positive change. We do have the statutory requirement written into the Health and Care Act 2022, and we will soon have the Oliver McGowan Code of Practice to support employers to really understand the high standards of training needed to meet the requirement. Now, Oliver's training has been designed to meet and set these standards. Now, we have support from the Department of Health and Social Care and NHS England. We have the Oliver McGowan Mandatory Training on Learning Disability and Autism, and we know it is the government's preferred and only recommended standardised training package. We have hundreds of approved trainers right across the country, with more being trained every single day. Oliver's training delivers all of the standards for the Oliver McGowan Code of Practice. It has been co-produced, co-evaluated and is co-delivered by experts with lived experience. We are learning directly from these communities, which is essential. Oliver's training will very soon be accredited, which is wonderful. Now, we know that Oliver's training is ambitious, but it is proportionate to the huge problems that we are trying to address. Quick workarounds and cutting corners will not meet the legal requirements, and we certainly do not want to, not bring about the culture change that we so desperately need. Cutting corners won't change anything. Now, the learning disability and the autistic communities will not and should not accept anything less. And let's be honest, none of us should accept anything less. Too many mistakes have been made, but we now have the means to really save lives that are currently being lost. The Oliver McGowan Mandatory Training on Learning Disability and Autism is the very first co-produced and co-delivered national training programme for health and care staff. And that means that over 2.5 million health and social care staff in England must have this training. And I can hear some of you say, well, why? And of course, the answer is very simple. It's because evidence tells us that staff in every setting need to be able to communicate with and make reasonable adjustments for people who use their services. People with a learning disability and autistic people are human, just like the rest of us, and they will need their dentist, they will need the GP, and they may need hospice care, cancer screenings, maternity services, urgent or emergency care, social services support, home support, and so much more. As such, they need support from all health and care staff, and not just your doctors, support workers, allied healthcare professionals, pharmacists and nurses. And I can't emphasise enough that this is for all staff and not just clinicians. Interactions with receptionists, porters, administrators, those who work in the restaurant can all make a massive impact to the experience and lives of a neurodivergent person. Imagine being anxious before an appointment. And many neurodivergent people are very anxious for very good reasons. Now imagine the difference it would make for you if you are met with kindness, compassion, empathy and understanding from everyone you encounter. Imagine the difference in the healthcare outcomes. Let's also imagine that leaders and commissioners have undertaken this training and from the outset have designed their services to meet the needs of neurodivergent communities. Just imagine for a moment the difference you can all make. And I hear that some organisations are finding this a challenge. And you know, honestly, we understand that. Not only is this a new training requirement, but it is training that is co-delivered by trainers with lived experience of a learning disability and autism who are paid for their time. That is essential. Now, we know this will be new for many employers right across health and care. And I know if it was easy, we wouldn't be doing this. People with a learning disability and autistic people wouldn't continue to face the highest rates of unemployment in the UK. And you know, I read on average that only 21% of autistic adults are employed. Please remember that, you know, many autistic people, they do not have a cognitive impairment. Many are highly qualified, some hold PhD degrees. They're more qualified than most of us. Isn't it outstanding and appalling that they can't find employment? The NHS also found that only 4.8% of adults with a learning disability are employed in England. Again, that is shocking. All of these people are employable and deserve to be employed. Not only does Oliver's training provide much needed employment opportunities, it is also a huge chance for employers to truly commit to equality in the workforce, in the workplace. Working with experts with lived experience challenges our thinking, practices, biases and presumptions. It also helps organisations and staff make the first step on this important journey. Organisations that have started this journey find that their staff grow their knowledge, their skills and their confidence in working and communicating with autistic people and people with a learning disability. They change their practice and gain confidence to challenge poor practice when they see it. I am so pleased when I hear all the positive experiences of trainers with lived experience who have joined the workforce for the first time, and we heard some of those on the video before. It was wonderful, wasn't it, really, listening to them telling their stories. I absolutely love hearing about the organisations who are adapting their recruitment practices, making reasonable adjustments and gaining so much from working with their neurodivergent colleagues. You know, every day I personally receive the most heartfelt and positive feedback about the difference Oliver's training is making to people's lives. Oliver's training truly is making a difference. Health and care professionals have told me how Oliver's training has made a difference to them personally and not just to their professional lives. And this includes experienced and busy GPs, consultant doctors across the many specialities, and of course, psychiatrists. So many people have reached out to me and openly said that they didn't think that they would gain anything new or learn anything new. They thought they knew it all, and they completed Oliver's training, and they are saying it has proven them wrong. People, families and carers contact me to share their relief at the positive experience of improved treatment and care and support when they access health and care settings. Now, look, I'd like to spend some time sharing just some of that feedback with you. And this message comes from a daughter, and she says, "My dad is a paramedic and he recently took your training course, and he told me that he thought it was great and really informative. He also said it taught him about my autistic son, also called Oliver, and it helped him to understand him better. And he said it will definitely help him with his patients moving forward, and that he will definitely change his approach that he would normally have taken. And this message comes from an administrator, and they write, although I'm not a clinical member of staff, I do work with clinical teams to support the development of patient pathways in cancer service. I just want you to know that Oliver will stay with me. His death has not silenced him. I am listening, and I will advocate and make sure where I can that every single person's needs are listened to, considered and acted upon, especially those who are more vulnerable to being ignored or lost in the system. This message comes from a nurse, and she writes, I'm a paediatric nurse in South Yorkshire, and I'm currently doing the Oliver McGowan Mandatory Training, and I think it's brilliant. As a practitioner who works alongside children with a learning disability and autistic children, I have found the training to be brilliant, insightful and useful. And this is coming from someone who feels well equipped to support these children and adults. So for someone who has limited knowledge, I can only imagine just how useful this training will be for them, especially listening to the accounts from people's own lived experience. Just wow. Now, we should all be proud of the difference that we are already making. And I know that many of you are working incredibly hard to adapt, create solutions and change ways of working to deliver Oliver's training. This will enable health and care staff to receive the very best training and everyone to receive the best health and care outcomes, which is what we all want. Look, we know that we do still have a long way to roll out this fully and make the training available to all health and care staff. But as we move through each stage of our journey to create a real change, we will need to overcome the challenges and the barriers and continue to learn to work together. That is essential. We have got to work collaboratively. We know it's not easy, and of course it isn't. You know, we have been told no so many times, me especially, I've been told no and to go away, or this won't, you won't get this or you won't get that. It's impossible. Well, look now, we have created a statutory requirement which is enshrined in law. I am not going anywhere. Oliver's training is now being rolled out. The change is now already happening. We have proven that we can do better. It's too late for poor Oliver and thousands of other Olivers. But all of us, we must remain steadfast and stay focused on achieving our shared vision. We can prevent more avoidable deaths and improve lives. I strongly believe if we get it right for people with a learning disability and autistic people, we can make health and care services and the organisations inclusive and supportive for absolutely everyone. You all have the power to make a real difference. Now, I would like to share a short video of our progress rolling Oliver's training out. Thank you so much. Thank you. Hello everyone. I have something incredibly exciting to announce today. To celebrate our approved trainers for the Oliver McGowan Mandatory Training on Learning Disability and Autism, I am thrilled to say that nominations are now open for the Oliver McGowan Trainer Award at the National Learning Disabilities and Autism Awards. Now, we currently have over 600 approved trainers who are co-delivering Oliver's training right across England. And you know that number is growing every single day. I know that each and every one of them are passionate and committed to making Oliver's vital training available to all of our health and social care staff. Now, this special award will acknowledge a special team of approved trainers or a specialist training provider who are championing and delivering the Oliver McGowan Mandatory Training on Learning Disability and Autism. And I know, bless him, if Oliver was here with us today, he would be more than proud of what trainers are doing by being brave, sharing their experiences and giving a voice to those voices who are not always heard, voices like Oliver's. Now, nominations can be made on www.nationalldawards.co.uk. And my final words to you are, good luck. I mean, goodness me, how the judges are going to choose, I do not know, because you are all worthy. But good luck and thank you.
Great, thank you so much, Paula, for that update. And it was really lovely to end with the video of you launching the Trainer Award. And there's another QR code for you there. There's the www link that Paula just gave you and the QR code. Please do encourage your trainers, or if you're a trainer on the call today, you know, have a go, put yourselves forward. So that's really exciting. And thank you for taking us on the kind of update in the journey. It was lovely to see so many pictures of people that we've worked with. So I think we've got time for probably just two kind of questions. So we've had a little bit of a look. We will answer the other questions, so please don't think we will ignore you. But there's a couple of questions that I'm going to ask our colleagues from Department of Health and Social Care to answer. There's one about when the code's going to be ready, and the second question about what support is there going to be for social care. So I wonder if you could just give us a quick answer on those two, please.
Yeah, thanks, Philippa. I'll take the code one first. So we're currently finalising the code of practice before it's laid in Parliament. And as mentioned earlier, there are a number of processes that need to be completed before we can do this. So we're not able to confirm any exact timescales at this stage. These processes include the standard sign-off processes across government, which are currently underway. And we are doing all we can to ensure the code is published as soon as possible.
Thanks, Emma. I'll take the second question. So to date, we've focused on building system-wide training capacity through kind of training for trainers and through funding provided to integrated care boards. But we have heard that there have been some challenges with access to Oliver's training in practice, and in particular from kind of employers in the social care sector. So we are looking into these issues at the moment and exploring solutions. And as mentioned earlier, we're also continuing to explore ways we can support the sector through kind of plans for adult social care workforce reform as well.
Lovely, thank you. And I think, Emma, before you sort of dive off, if people want to see the code, the draft code was published. It's not vastly different, the final version. So all the key elements of Oliver's training that set the standards in the code, it's the same. So if you're worried about what it's going to say in the content of it, have a look at the one that was published for consultation, and that's still the one to go for, if you like, and that's the one that Oliver's training meets. So it's still all relevant, I think, is the information I just wanted to kind of to flag. So thank you both, that's great. And I think one final question for Paula, if Paula's still with us. We get a lot of questions, and I know when Paula and I do these talks, we do around kind of general practice, GPs, primary care, and the challenges there. So does the Act, so I'm just going to ask the kind of question that's come through, does the Act actually cover general practice, Paula, and kind of what are our expectations, do you think, for making sure that primary care is part of this journey?
Well, of course, the Act does cover our general practices. I mean, it's essential, isn't it? First, that our GPs get the right training. You know, people have told us how scared they are when, you know, the first port of call going to the GP. But it's much wider than that, because, you know, receptionists have a vital role to play in supporting patients. It's not just about doctors and nurses, but the wider practice. You know, like the healthcare assistants, the pharmacists, the physios, the mental health practitioners. You know, I often talk about, especially when I'm doing these presentations, about often when our communities meet a receptionist that may not be able to support them or understand how to support them. Without the right support, that person facing the doctor can be very different to the person that they normally are, due to those reasonable adjustments not being made. So for me, that really is essential. Now, again, I'm going to go on a little bit here. Most of the practice team will definitely need Tier 2. Only staff that don't interact with patients would need Tier 1. So if you are working with the public, irrespective of autism and learning disability, if you work with the public, you will need Tier 2. And the practice work, you know, can go with the local integrated care boards to consider how they can access that training. So use your ICB boards to help you. I'm going on again. Any staff that deliver virtual appointments will definitely still require Tier 2. We know that some practices are using their timeout sessions and receiving the Tier 2 as 2 separate half-day deliveries, which works really, really well, and, you know, it's something that we would support. Now, we have heard from staff and GP practices that after completing Tier 2, they've actually gone back into their practice and immediately made improvements to their waiting room, such as the lighting and how they communicate with people with a learning disability and autistic people. I mean, that's fantastic. You know, this training is particularly important for general practice, as we have heard, as I've just said before, from autistic and learning disabled, you know, disability communities, that unplanned or urgent care can cause significant anxiety, and creating a safe and accessible environment in a GP practice would make a huge difference to patients and to their families and carers. So honestly, this is essential that our GP practices get this training and get it fast, in my opinion. Thank you, Philippa.
Thanks, Paula. Brilliant. Okay, so I am mindful of time. So we've covered an awful lot of information today, which we hope you found useful. In terms of what can you do now, please encourage everyone in your organisation and local systems to get on with the e-learning, and then sort of, you know, support them to build the capacity. Get organisations, if your organisation's on the call, start thinking about your priorities for rollout. You know, which staff groups are you going to prioritise? Keep going with the delivery, build that capacity. You know, we need you to do that. Celebrate any success that you have in terms of the progress in your organisation. You know, it is a very public programme, a lot of interest on social media, and let's remember we're trying to make a real movement of cultural change here. So, you know, let's keep those messages going to, you know, to make it as visible as possible. Raise awareness of any opportunities with even colleagues like HR, you know, review your recruitment processes, anything like that. Just get everybody involved. You know, that's what we're after here. We will share the slides and recording. I hope that it works. I've said that before, we haven't worked, but the team are fantastic, so I'm sure it will. So quick ramble at the end there. So I just want to say a huge thank you to so many of you for attending today. Please do use another QR code that I think is on the final slide, which is going to give us some feedback about how useful you found it. Thank you so much to all the speakers today, both those that were here in person and those that produced the videos for us, and the team that have run the day, because as you saw, technology is a bit of a challenge sometimes, isn't it? But the team are amazing, all calm and professional. Thank you for the questions. We will get round to us answering them. Thank you for your engagement, your ongoing support for Oliver's training, and let's get the Oliver McGowan Mandatory Training on Learning Disability and Autism out there as business as usual as soon as possible. Okay, thank you so much, everyone, and goodbye.